You've seen it everywhere online, right? Intermittent fasting. It's one of the biggest trends out there. But if you have diabetes, all that buzz brings up a really important question. Is this a game changer for your blood sugar? Or is it just another risky fad? Well, in this explainer, we're going to cut through all that noise and look at what the real clinical studies and the actual glucose data have to say.
So that's the big question we're tackling here. Is this a breakthrough or is it a bust for managing diabetes? Stick with me for the next few minutes and we're going to get you the answer.
Because let's be real, what matters isn't some influencer's post, it's actual, verifiable evidence. We've dug into the research so we can give you a clear, data-driven picture of what's going on.
Okay, so first things first, let's separate the hype from the reality. What exactly is intermittent fasting anyway?
So at its heart, intermittent fasting, or IF, isn't a diet in the way you might think. It doesn't actually tell you what foods to eat. Nope. It's all about when you eat. It's a pattern that creates specific windows of time for eating and for fasting.
Now you'll probably hear about a few different ways to do this. The one you hear about most is time-restricted eating, like the 16-8 method. That just means you fast for 16 hours and have an 8-hour window to eat. There are others, like the 5-2 diet or even alternate day fasting. But honestly, most of the really promising research for diabetes zeroes in on that first one. All right, now for the main event. This is what you came for. What happens when we actually put intermittent fasting to the test in clinical trials?
Okay, this is a big one, so listen up. A 2023 study in a major journal, Diabetes Care, found that folks with type 2 diabetes using that 16-8 method boosted their time in range by an average of 12%. And just so we're clear, time in range is a super important metric. It's basically the percentage of the day your glucose levels are staying in that safe, healthy zone. So a 12% jump is huge. It means way more stability and fewer of those damaging spikes and crashes.
And it's not just about day-to-day stability. Look at this. That same study showed an average drop in HbA1c of 0.7%. To put that in perspective, that's the kind of improvement you sometimes see when someone starts a brand new diabetes medication. A drop like that is a really big deal because it's directly tied to a lower risk of serious long-term complications.
Okay, now this is where it gets really fascinating. It turns out that when your eating window might be just as important as the fasting itself. A study from 2022 discovered that an early eating window, finishing your meals by late afternoon, improved insulin sensitivity 3 times more than a later window. It suggests that our body's engines are just running more efficiently earlier in the day.
And here's the crucial reality check, right? Let's not get carried away. The research is clear that a huge chunk of the benefit from fasting comes from a pretty simple fact. It often makes people eat fewer calories and lose some weight. So it's not exactly magic, but just like we saw, that early eating window seems to give you an extra metabolic advantage on top of just cutting calories.
So, if you were even thinking about this, you're probably wondering, which one should I even do? Let's break down the options.
So if we look at this, you can see there's a clear trade-off happening. Something gentle, like a 14-10 protocol, is super easy for most people to stick with, but the impact on blood sugar is a bit lower. The 5-2 diet can work, for sure, but man, those 2 low-calorie days can be really tough. For a lot of people, that 16-8 protocol, especially if you can manage an early eating window, seems to hit that perfect sweet spot. It's really effective, and it's something people can actually sustain long-term.
Okay. This might be the most important question of all, because even though the data is promising, intermittent fasting is absolutely, positively not a one-size-fits-all approach.
So let's get specific. Who does this tend to be a good fit for? Well, it often really helps people with type 2 who are dealing with insulin resistance or those stubborn high morning blood sugars. But, and please hear me on this, who needs to be extremely cautious? Anyone with type 1 diabetes. The risks of dangerous lows and something called diabetic ketoacidosis are just much, much higher. And I can't be more clear about this, DKA is a life-threatening medical emergency. Also, if you're on medications that actively lower your blood sugar, like insulin or sulfonylureas, trying to fast without your doctor's close supervision is just playing with fire.
Look, and that's a big if you and your doctor decide this is something you want to explore, safety has to be your absolute top priority. Let's walk through what a responsible approach looks like.
And I really, really cannot stress this enough. Even thinking about starting intermittent fasting without first talking to your doctor, especially about your medications, is an absolute non-starter. Some of your doses will almost certainly need to be adjusted to prevent a dangerous low blood sugar event. This is your non-negotiable first step, period.
And just to be super clear, these are the specific types of medications we're most concerned about. Your basal, or your background insulin dose, often needs to be dialed back. And of course, you'd skip mealtime insulin for a meal you're not eating. Then you have sulfonylureas. Those are the pills that make your body pump out more insulin. Those might need to be cut in half or maybe even stopped on fasting days. But again, these are not decisions you make on your own. This is a conversation with your healthcare provider.
So here's your 4-step playbook for a safe start. 1. Get medical clearance. Talk meds. Talk monitoring. Get the green light. 2. Start gently. Don't jump into a 16-hour fast. Try a 14-10 protocol for a few weeks and let your body get used to it. 3. This is so key. Monitor your data like a hawk. A continuous glucose monitor is the ideal tool here. And 4. When it's time to eat, break your fast smartly. Don't hit your system with a ton of carbs right away. Start with protein and healthy fats to prevent a massive blood sugar spike.
So at the end of the day, after looking at all the studies and all the advice, what this all really boils down to is one single thing.
And this, right here, is the bottom line. Intermittent fasting is a tool in the toolbox. It's not a magic bullet. You have to treat this like your own personal science experiment. If you try it, you do it safely for, say, 12 weeks, and you don't see any real improvement in your glucose numbers, that is not a failure. That is just valuable data. It's your body telling you that this particular tool isn't the right one for you, and it's time to try something else.
So whether intermittent fasting is for you or not, the real question is this. What story is your own personal health data waiting to tell you? What patterns, what insights, and what amazing improvements are hiding in there just waiting for you to find them?